Welcome to the Medical Receptionist Network podcast show. I'm your host, Shivhon Adkins. Join us as we discuss the importance of clerical and administrative roles and their impact on the healthcare industry. Hello, welcome to episode 14 of the Medical Receptionist Network podcast. I am Shivhon Adkins, and today I am just coming back after a very, very long time. I wanted to make sure we touch base in 2020. We're looking at December 2020 right now. It's been quite a challenging year for the healthcare community. I feel like this is the year that just keeps on giving, and not necessarily in the best ways, but people are really, showing up and doing the best they can, physicians, nurses, our front desk staff, and everyone in between, even on administrative level, pulmonology department. Everyone has really had to come together in healthcare for the, betterment of what's due to what's going on right now. And to make sure that they are able to keep their offices open, able to keep, treating patients and keeping them safe in a way that wasn't as much of a worry in the past, with the coronavirus and having declared a pandemic in the US in March. A lot of things have changed for everyone. Healthcare, especially, some places have been overwhelmed, and some places have been underwhelmed because they are, have lost patients or have not been able to provide the care that they used to provide. And maybe, people are putting things off and waiting to seek treatment. And so there's been ups and downs in every direction. You have some places that were overwhelmed and they needed help and additional staff. And there are other places I know where, people may have been laid off, whether it was permanently or temporarily, after offices chose to move into a full telemedicine space. So, while that's, I think in some ways it's been really good for a lot of people, a lot of offices with telemedicine, because if they weren't using it before, they were kind of thrust into it. So it's just now, when things begin to change and normalize, which is probably quite some time from now, but when, offices start to see their typical amount of patients, but they now will have this additional way to treat patients. And so, we kind of got thrust into the telemedicine for those who were not either on board or just really, wasn't a priority. Maybe it was something that their office had access to, but it wasn't necessarily something that they used. I know plenty of practices who this year jumped into it, and it was a learning curve, but they got through it. And then bringing patients back in the office as things started to change and restrictions were lifted in various places, we're able to continue having that as an option for their patients. And I'm sure plenty of you all have had experience and had to learn new things and how to get patients connected to the doctors and the other providers in your office, and trying to use your electronic systems and your portals, and encouraging even more of that than probably in the past, just so that everyone, so there's less exchange and less filling out paper, exchanging pens and just tablets and things like that, and having people do things from home, and checking in from the car. So there's been so many changes, but also when you think of healthcare, we can't not mention the toll that this pandemic has taken on the long-term care facilities. Unfortunately, the nursing homes and facilities similar to that have had the most deaths, unfortunately. And, that takes a toll on anyone. If you're working somewhere and you're seeing, more loss than than you may have seen in a year or, 10 years, it's something that, is not going to, it can't be ignored, and it's something that we all have to make sure that we're checking in, with ourselves and with our coworkers. And, mental health is extremely important. And this year, I think, was quite the test for many people, whether it was working in a hospital, long-term care, or an office, because, you're dealing with patients, with all kinds of pre-existing conditions. And even you yourself may have had, to make some decisions
about whether you could continue to work because of your own health. So I understand that this year has been quite challenging for many people in the healthcare community, and we definitely have to talk about that. Even the fact of all the things that we've gone through since, I will say, January, but for the most part March, when things started to change, especially in the US, it was just life changed almost in an instant, and so for most people, their family life changed, the child care, the education, the kids in college, everything really kind of slammed us at one time. And so even as a healthcare worker, you're dealing with everything that's going on at work, and then you have to come home and deal with everything that's going on at home. Or maybe you had to stay home because you didn't have, the support, or, the child care or access, that you needed to keep your life the way it was, before we were declared under an emergency. Things started to close down. Um, there's there could have been, work changes with other people in your household that have affected your financial security, your food security, your home, your rental, your home, your mortgage, and things like that. So there's a lot of things that have affected, many people, and we can't, ignore that and just focus on, I like to think of the whole person. And you come to work and you're dealing with all these other things, and so are your coworkers, and so are your, other colleagues in your office or in your hospital or facility. So it's important to make sure you're checking in with yourself and seeking out any help that you may need, whether it's in the way of counseling or just support or just picking up the phone and talking to a friend, getting fresh air, getting a break when you need it, and just, acknowledging that yes, things are different, and it may be hard, And personally, I've actually had some loss this year, and I lost my dad, lost my uncle, and I also lost an aunt this year. Not to COVID-19, but to have to and go through that with my family during a pandemic, which many people have had to experience this year, was, quite challenging. And so I understand, so people unable to see their family, their grandparents, their, you know, uh, any family that you have that's in a nursing home or a long-term care center or out of state, just, everything has been, changed to a lot of people are doing video, and I know people are traveling, and that's fine. But for a lot of people, that's not happening, and people are just not able to have those same connections and communication. So I just want to, touch on that and know that, you're not alone. A lot of people are going through a lot of what you may be going through right now. But, I just want to make sure that we always stay encouraged, reach out to people if you need to. Make sure, if someone reaches out to you, that you're honest with them. If you're struggling, it's okay. It's okay to talk about that. If you are doing really good, share that, because that might be something to uplift the person who's on the other line. Whether it's your friend or your family member who you haven't spoken to in a while. Obviously, we always kind of say, counseling, therapy, if it's something that you need. Make sure you're checking in with your spouse and your children, because this is, I'm sure, very difficult for them as well, as things have changed with schools, and online learning has been quite a challenge for a lot of people. And I think that, sometimes it's hard to tell if your child is having a tough time or not. So on top of everything else, we have to make sure we're, paying attention to the people around us, that we're holding each other up in support. Don't give up on making memories and having good times. It just, we just have to do it a little differently now and more cautiously. My goal at different points in the year was just to try to create some good memories within the year, so that when I do look back and reflect, that it doesn't have to be all, gloom and doom. Unfortunately, quite difficult to get around. Within that, there's still a lot of sadness and things, but I just feel like we have to, we're still here. We get to keep going. So do it in the best fashion that you can. We learned a lot of lessons in 2020. There's a lot of experiences that, may be better left forgotten. However, it's brought a lot of people closer, whether it's your colleagues, not closer in distance, but closer in, communication and things like that. A lot of great ideas have come to fruition. People have used their time to learn new things and to, maybe put a little more effort into their own health or their own business, their education. Healthcare itself has had to be quite even more innovative at a very fast pace, and people have really had to, work together and figure things out to continue to provide good health care and consistent health care, especially for the people who have chronic illness and need to, receive their care, their medication, their treatment, no matter what is happening. And we're able to really keep that going and make sure people had access to what they needed. And we're also learning what works. And what really didn't work too well. There's some things, it's like, oh wow, we learned this, or we figured out how to better process our patients, or register our patients, or we know now that maybe these type of appointments need a certain amount of time, and maybe things that you didn't really have a time to really focus on or look at, you've probably been able to make some changes that you will keep outside of the pandemic. And there's other things that you're doing right now that you would never do outside of a pandemic circumstance. So I think there's, a lot of learning, a lot of, changes along with the challenges. But we're here. Your contribution is most definitely needed. And, you may feel defeated at times, but just make sure you take that time to check in, and always make sure that your dedication, your sacrifice, and your time, it does not go unnoticed. You're appreciated. For anyone listening, it doesn't matter what part of healthcare you work in. You are doing a great job. Thank you. We thank you. I'm giving the we thank you from everyone for sticking in there and hanging in there, and being such a support system, being consistent and dedicated in your job. I know it's difficult, but please, continue to do what you do. We need you, and support it there if you ever need it. So that's pretty much all I have for today. I do look forward to coming back in 2021 a little more regularly. I think, as things happen, we're gonna see, different things change in as far as careers go with healthcare, front desk and medical receptionists, and expanding roles, which you may see. I'm sure a lot of people have learned new things, because as much as you would think that because healthcare was so overwhelmed over the last few months, that people have security and in their employment, and that's not always the case. Because when you make certain changes, some people have been let go, and some people, even in healthcare, some people, maybe their function at their particular office just didn't fit into what was required due to the pandemic, as well as maybe the office didn't have enough space to have all of those people, at the same time. I'm sure you think about your own experience going to medical offices, to have, your front desk members 6 feet apart. A lot of offices cannot fit more than two people, and some it may be one, because it just depends on how the office is set up. A lot of places have had to reduce their hours, or maybe take on an additional day so that they could accommodate their staff and things like that, as well as patients. So I know there's been lots of changes, and I'm so appreciative, and I'm proud to be a member of the healthcare community. I know quite a few frontline workers who are, they never gave up, and they're just doing the best that they can, and it's been very difficult. I have family members who work in healthcare, and it's just, it's amazing, and it's horrifying all at the same time. So again, I'm Shivhon. This is the Medical Receptionist Network podcast, episode 14. You can visit medicalreceptionistnetwork.com or check out one of our affiliates on the show page. Pro Trainings has CPR courses and other courses that you can complete online. I actually obtained my BLS from there, and I can confirm that the program is very thorough. The videos are great. I was able to do it in one day, a few hours. But I thought it was great for an online training. It was really great. And so, if you want to check that out, if you want to have any additional trainings under your belt, they have fully online. If you actually if you need the demonstration where you actually have the dummy with you, they offer that. They mail it to your home, and you can see that portion via video. So they're pretty innovative in what they've done. And that was even before 2020. So you can check out Pro Trainings, and there's a discount that you get with our affiliate link. Again, I'm Shivhon. Thank you so much. Have a great holiday season. Feel free to share this. And if you have any questions or would like to be interviewed on the podcast to share your experience in healthcare, I would love to have you send us an email, info@medicalreceptionistnetwork.com. Have a great day.
Thank you for listening to another episode of the Medical Receptionist Network podcast show. Don't forget to visit our website, medicalreceptionistnetwork.com, and subscribe to our newsletter. If you're looking for a great resource for medical receptionists, make sure you grab your copy of the Medical Receptionist Handbook to Success, available on Amazon. Lastly, if you have not subscribed to this podcast, please find us on your favorite podcast player and subscribe today. Until next time, keep being amazing.